I always looked upon OSHA as ensuring Americans of a new right in the Bill of Rights, the right to a safe and healthful workplace.
The convergence of the mine disasters, the black lung, the environmental episodes that were evolving, its time had come.
There are workers today that are alive because of passage of the Occupational Safety and Health Act.
This bill could not be signed unless it had had bipartisan support, Democrats and Republicans working together.
We were under heavy pressure to get OSHA going in a hurry. We did, for the most part, get things going. We took some pieces of paper, we put flesh and blood to them. We developed in Washington and around the country a network of dedicated safety and health people.
One of the most striking things we found when we first went into the textile mills was a direct relationship between the level of cotton dust and this disease we know as brown lung.
We got ready to issue the cotton dust standard, and the economists in the administration wanted it watered down. And I talked with President Carter about it. He encouraged us to issue a standard that would really protect the health of workers.
One of the most important things OSHA has done is the Right to Know Hazard Communication Standard, giving workers and the public information about the chemicals that were being used, which enabled action to use chemicals in a way that limited worker exposures.
The Reagan administration issued an emergency health warning to workers. This one deals with asbestos, and it cuts by 75% the amount of asbestos fibers that workers may be exposed to.
The Labor Department today began public hearings on the potential health hazard of vinyl chloride.
The Occupational Safety and Health Administration issued new safety standards today to prevent grain elevator explosions.
Coming out of the construction industry, I know that the more inspections you have on a project, the better project you have at the end of the game.
We're not the same rust-belt workforce, and so problems in the workforce change.
We've got healthcare being the biggest industry right now in the country, and with that we've got problems of back injuries, chemical exposures.
My vision for the Department of Labor is to provide good jobs for everyone, and I mean everyone. From business offices to field and construction workers, good jobs that are safe jobs.
What our company has learned over the years is that an effective safety and health program makes us more competitive in a global economy. It has enabled us to save on our workers' compensation costs and has boosted employee morale. At the end of the day, many more fine shipbuilders are returning safely home to their families because of our strong safety and health program.
Everybody in our country has stock in the health and safety of workers, and it's critical that we get a handle on these problems because they are the forerunners of environmental problems that will affect us all.
A Phillips petroleum plastics plant blew up, injuring more than 80 people and scattering debris as far as 6 miles away.
The blast at the BP Refinery in Texas City was the worst in this country in 15 years.
Catastrophic events are powerful reminders that thousands of workers across our country continue to face risks at work. Every day in America, 12 workers are killed on the job. And every year in America, more than 3 million workers are seriously injured, and many more than we know are sickened by exposure to toxic agents. These injuries, these illnesses, these deaths are preventable. This isn't only OSHA's challenge, it's the nation's challenge.
I've worked with employers that clearly see that an effective safety and health program makes their company more competitive in a global economy.
We all have to figure out how to come together to address these problems to make sure that workers are protected from the new hazards.
We must continue down the path we started 4 decades ago toward a day when no one will ever have to give up their safety or their health for a paycheck.